the Honorable Lourdes A. Leon Guerrero, Governor of Guam, Magahagan, Guam.
Thank you, Janella. Before I begin, I would like to acknowledge a couple of senators for their assistance with Executive Order 2020-07. This executive order will extend the closure of all non-essential businesses and facilities to April 13, suspend all eviction proceedings, clarify laws on price gouging and open government, and require businesses to report employment data to the Guam Department of Labor. Thank you to Senators Mary Torres and Regine Bisco-Lee. I would also like to clarify national media reports that Guam was being considered as a repatriation site for American citizens abroad. Through my conversation with the commander of Indo-PACOM, Admiral Phil Davidson, I received word that this is not the case. As the number of positive cases increase, as we still mourn our first and only death related to COVID-19, and as we come to terms with this new normal, many of us are starting to feel the impacts of this pandemic. The need for us, all of us, to act with empathy, kindness, and compassion is ever present. But as in most disasters, tragedies, and public health threats, there are reasons for hope. This morning, my request for a presidential disaster declaration from Guam has been approved. This declaration will allow us to access federal programs to help our people as we do all we can to fight COVID-19. I would also like to announce that after an assessment by Public Health, 7 home isolation patients have fully recovered. According to CDC guidelines, this means at least 3 days have passed without fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. Despite being no longer infectious, we will continue to monitor their status. However, I must note that our patients are not recovering as quickly as we are discovering new cases. For every person cleared of COVID-19, we are gathering even more confirmations, and recovery varies from person to person. Some will report feeling fine, but others will experience long-term issues related to the infection. However, I am encouraged to see that people are taking this more seriously. In one of our facilities, our quarantine facilities, those who have been cleared to leave earlier than the quarantine period have decided to complete quarantine at the facility, protecting their families and our island. Their decision is something we all need to emulate. We have a limited time frame to flatten the curve, and now is the time to act. We are not yet out of the woods, not even close. All the data I have been presented with shows that there is strong possibility that our infection rate will be greater than what we are seeing today. We are testing the limits of our healthcare system, and we will reach that limit soon if we don't act now. If we don't continue to practice social distancing, if we don't adhere to the social isolation directive, this fight will continue much longer than any of us can prepare for. The worst is yet to come, and the best course of action is to act like you are already infected. But over time, we will see the change if we remain steadfast and alert. I know many of you are concerned with COVID-19 cases on the USS Theodore Roosevelt. We cannot forget that among those sailors are our own people. More than 20 of them are our residents, sons and daughters of Guam. We cannot forget that they have families who are worried and afraid. We cannot forget a mother's plea asking us to understand. Fear can harden hearts, but remember, now is the time for compassion. Now is the time for unity, for sympathy. We would not be where we are now if people didn't go out of their way to help the community. I know you're afraid, but instead of spreading fear, let's spread kindness. Today's COVID heroes are Infusion Coffee and Tea and Good to Go. Together, they deliver coffee and tea to the GMH, ICU, and ER healthcare warriors who have been working tirelessly to ensure we are healthy and safe. This is just one example of our business community doing what they can to help our frontliners. COVID-19 has unleashed an incredible amount of solidarity, creativity, and charity. With these qualities, we will be able to tackle this crisis together. 2020 will be a year we will all remember. Everyone will experience it differently, but I hope and believe that feelings of solidarity and hope will prevail and bring us all closer as we get through this most difficult of times together. I would like to now call Linda to give us an update on our status with our COVID-19.
Thank you, Governor. Yesterday, we conducted 40 tests, and of the 40 tests, 36 were negative and 4 were positive. From the testing done beginning March 12, 2020, all the way through March 27, 2020, there were a total of 350 tests. And of that amount, 299 were negative and 51 were positive. And realizing that of the 51, 49 were positive from our community and 2 were from the military. And that gives a total of 51. In regards to the COVID positive patients, 28 are in home isolation, 5 are in SNU, 10 are GMHA, 1 death, and 7 recovered, totaling 51. In regards to the demographic information, 15 are from the northern region of the island, 21 are from central, 9 are from south, and 6 are pending determination. Again, bringing the total for 51. In regards to the age group demographics in that regards, we have no one that has tested positive for COVID below 19 years of age. For the age group 20 to 29, we have 4. For the age group 30 to 39 years of age, 5. 40 to 49 years of age, 9. 50 to 59 years of age, 9. And 60 to 69 years of age, 15. 70 to 79 years of age, 5. 80 to 89 years of age, 3. And 90 and above, 1. Again, totaling 51. In regards to the gender demographics, and we have 20 that are males and 31 that are females. The medical status of all these patients, 28 are in stable condition, 15 are hospitalized, and of the 15, there are 9 that are in the inpatient GMH facility, 1 at the ICU, and 5 at the SNU. 7 have recovered, and 1 has died. And again, that's the total of 51. In regards to the travel history, 1 from Japan, 8 from the Philippines, 0 from South Korea, 2 from the US mainland, and 40 with no travel history at all.
Thank you, Linda. I think we're open for questions now.
Okay, just a reminder again, we're going to unmute you one by one, and you get 1 question with 1 follow-up. We'll begin with KOAM. Lester, your question.
Yes, thank you. Afternoon, Governor.
Good afternoon.
Wanted to follow up on something that we had seen from one of the national media. It was the head of the Army Corps of Engineers was talking about doing assessments of all the 50 states and 5 territories about renovation of facilities for COVID-affected patients. Has there been any discussion with Guam about that?
Absolutely. I think 2 days ago, I did a conference call with the Army Corps of Engineers, which also the heads from Hawaii. And what they're doing is they're offering facilities, because throughout the United States, their healthcare systems, specifically the hospital acute cares, have been overwhelmed and have been they're busting at the seams. There's a lot of overflow, and so what they are doing is they're working with the various governors, and we were offered this, that what they would do is come in and retrofit, say, a facility to be a hospital, and they can do it within like 2 or 3 2 or 3 weeks time. They'll bring in their engineers, they'll bring in, they'll subcontract with people here. We are in the process now, Nestor, of working with our medical community and also the TAG. I have asked the TAG to take the lead on this one. So she's been meeting with the various healthcare providers and the healthcare leaders in the various healthcare institutions. And she's gonna present a report to me. They can retrofit a facility that can house up to 250 beds. So I was very appreciative with this offer. They are also very focused on our situation here, and they will work as expeditiously as we can to be able to again increase our facility capacity to treat our COVID-19 patients.
Nestor, your follow-up.
All right.
question?
Yes, I just wanted to get an update on the test kit situation. I believe you only have about 50 left, which would be at the rate we've been testing, less than 2 days worth.
Yeah, let me have Linda answer that.
Yes. In regards to our test kits, we are very fortunate that we are 10 more to completing the first kit. And because we don't have to revalidate the kit again, we were fortunate enough that we haven't opened the second box, so we will be opening up the second box. So now it will be about 300 test kits, give or take between 300 to 400. So we're very fortunate to have this readily available as well.
Okay. Can I just add something to Nestor? I have also been working with FEMA to get us 1,000 test kits here. And also Linda's been working very closely with CDC to get 1,000 here. We're also, I have also asked Admiral Manoni if he could, through his military network and channels, see what we can do, if we can get more test kits from them. And Admiral Davidson this morning said he would work with Admiral Manoni to see what can be done.
Okay,
Thank you,
Nestor. Next, we'll go to PDN. Jasmine, your question?
Yes, thanks, Governor, for your time. Going to the stimulus package, do we know yet how Gov Guam will set up the infrastructure to handle unemployment provision and direct cash payments?
Right. So as you know, the House passed the coronavirus stimulus package of about $2 trillion. The Congress is already saying that's not enough. So I think they're looking at a fourth phase package to be about $4 trillion. But in this particular package, President Trump signed it immediately. So it's in effect. We are working, Jasmine, to see how those are going to be distributed out. For the unemployment, I think there's several packages there. We would have to work through the Department of Labor and work under the Disaster Unemployment Assistance Program. Because we don't have unemployment insurance, I think there are other assistance there that we would be able to get. As far as the tax rebate, there is a provision there for tax rebate of one-time tax rebate of $1,200 for a single person, $2,400 for a couple, and then $500 per child. So I am encouraging people to make sure that they fill their taxes and that they filed their taxes. They're going to look at tax return 2018 and tax return for 2019 because it's also an income influence. So people that make $75,000 and below will get the $1,200, and couples combined income, I think that are 150, also will get the $2,400. The share or the assistance becomes lesser as your income goes up. So we're working with U.S. Treasury, Daphne, sorry. Daphne, our director of DRT, has already been talking to them. She's getting all our data together based on the recent tax filing, and they're going to go from there. As far as the $111 million, that is going to come out of the U.S. Treasury, and we are still trying to find out how they're going to do that. I'm suspecting and assuming, just from discussions of our conferences with the president and the vice president, where all the 50 governors of the 50 states and the territories are requesting that be a direct subsidy to their government, which means it would be a direct subsidy to the general fund of our government. And I think it would be under the control of the governor.
And Jasmine, your second question.
Yes, please. So of the 7 patients who have recovered, are you able to say how many were asymptomatic?
You know, I don't have details about that. No, I don't.
All right, thank you.
Thanks, Jasmine. We'll move on to PNC. Luella, your question.
Yeah, I have a question about the, so exactly, now that the President Trump has signed the relief package, they're contesting contesting information in terms of the numbers. So what exactly will Guam be getting? Is it 111 million or more?
Our Guam portion, you know, in one of the provisions of the section, I have to say the Democratic leadership in the House from the various territories really advocated for this through Speaker Pelosi, and they had included it. It's an amendment to the bill. And what the bill has, they had a provision for $150 billion of direct subsidy to the states and the territories. And off that $150 billion, we got $3 billion for the territories. So the territories are American Samoa, Guam, Puerto Rico, and the U.S. Virgin Islands. And they calculated it based on population using the latest census. So with that, Puerto Rico got the bulk. I think we got like over 2 billion, and Guam got 111 million. And then I think the next one was U.S. Virgin Islands, then CNMI, then American Samoa. I don't know their exact assistance there, but for us, we got $111 million.
Okay.
Luella, your next question.
I don't have a follow-up. Thank you so much, Governor. Thanks, Janella.
Thanks, Luella.
You're welcome. Next is Mariana's Business Journal. Maureen, your question. Maureen, are you there?
You hear me?
Yes, we can hear you.
Oh, that's good. Buenas, Governor.
Buenas, Maureen.
So I'd like to ask you, how many people have applied directly to the government of Guam for jobs? What is the administration doing with those applications? And how many people can you employ at one time? For how long?
Jobs for the government of Guam?
For
Jobs
unemployed
to the government of
citizens
Guam?
who have applied to the administration
For
for
the
jobs.
assistant? For the assistant?
I understand there are people who have applied directly.
I don't know, but the process I understand, and I know that the Department of Labor and GIDA are working with the various business organizations and Chamber of Commerce to also get the numbers of unemployed people, get the numbers of how many people whose working hours have been decreased as a result of the coronavirus, and how many are still employed. And so I think they're trying to get all that data together so they can have a number to work with the Department of Labor.
And Maureen, your next question.
Yes, I do. So the one-time stimulus checks for eligible people has a verification process that involves the IRS
Right.
and Rev and Tax
They have
to
to,
verify
right,
if they have a social security number and are on the tax rolls.
right.
So is Rev and Tax prepared for that?
Revenue and Tax has been working daily to identify those numbers. And that's why in my presentation, I had asked our people to make sure that they have filed their 2018. And if they can file their 2019, that would also be great, because we're working off of our tax rolls and our tax filing. And Daphne has been getting that information and data.
Thank you,
Okay, thank you.
Next, we'll move on to Guam Daily Post. John O'Connor, your question, please.
Hello, Governor. This is John O'Connor from the Guam Daily Post.
Hi, John.
Hello, ma'am.
Yes.
So, is Revenue Tax open and available for people who want to file taxes?
They're not right now, but we're meeting to see if we can either do it through online, which would be the best. And then if we need to put people in there specifically for this, I will be discussing that with the director. She would have to work with me on what her needs are in order to get this all ready. And with the, of course, with the attention to making sure that we don't have exposure to our employees, or even exposure to people that would be coming in. I'd rather not have people come in. If we can do it in other ways, we'll do it that way. Because we need to remember that we have to protect our community and our island.
John, your second question?
Right. Going back to the Theodore Roosevelt, do you have updated numbers on the positive cases, and how many of those sailors are Guam residents?
I do not have those numbers, but you could refer to Admiral Manoni for that information.
Thank you, John. Finally, we have Pacific Island Times. Phil, your question.
Hello?
Phil, yes, go ahead.
Okay, so we heard that there's a doctor who got infected with the coronavirus, and he is currently at ICU at TMH. Can you confirm this?
I'll have Linda come talk to you, but that's news to me, Phil.
Okay.
Lillian.
Oh, sorry, Lillian. That's okay.
Lillian.
No, that is untrue. There is no doctor who is COVID positive and in the ICU. It's not a doctor.
Not a doctor to do with it.
No,
I mean,
There's no doctor that is
doctor.
COVID positive.
Okay, thank you.
Okay.
And your second question, Phil?
No, so she already answered it earlier. Thank you.
That's your only question?
Yeah, thank you.
Okay, we just want to remind the media to please get your sources verified. And we also have the Joint Information Center. That's the reason why we have the Joint Information Center, is to use verified sources only. We've been seeing a lot of fake news circulating. And so we just want to work with the media and remind them to please only use verified sources. It helps with messaging and ensuring that the public gets the correct information out there. So thank you, everybody.
Can I ask another question since we?
Governor?
Can I ask another question since a couple of people didn't have follow-ups?
who is this?
This is Nestor. I'm sorry.
Oh, sure. Sure, Nestor.
Yeah, Governor, you said the worst is yet to come. What did you mean by that?
Well, you know, I'm looking. I have been working with the Medical Advisory Council, and they are putting together data and information, and they're tracking how various places are the experiences of the various places. And for our population and our size, they are talking about all this R0, infection rate, and so forth. And when they map it out, they have informed me that we are just at the beginning of what could possibly be the worst case scenario, and a major surge. And so we're still working along those data information, and they're still discussing this with their advisory group. But one of the very significant piece of information is that because we have started early in our actions, that this is going to help us in terms of helping to flatten the curve. But we cannot let our guards down. We cannot be complacent. We even have to work harder because from that data, it's showing that probably in a week, we would see much more of a surge happening. So I want to prevent that. And to prevent that, I need everyone's cooperation to, like I said, stay home, wash your hands, cover your cough. If you're sick, call your doctor. All these things. The thing with this coronavirus too, Nestor, and you guys probably don't know this because you're very well informed, that no matter what the testing is, it doesn't change the course of our action. And to be very conservative, I am saying assume everybody is positive and behave that way, because that's how we can protect ourselves, protect our families, protect our community, and that we can beat this god-awful invisible virus.
Thank you so much, Governor. Thank you, everybody. Have a great day. Please stay safe.